Dealing with difficult colleagues can be very challenging, and it can be a very stressful part of a primary care physician assistant or NP's job. In order to make sure that you are able to deal with some difficult colleagues, here are a couple of pointers. First of all, it's a high-stakes game when it comes to patient care. Any consequence or mistake could lead to harm to the patient, but that's also your biggest resource because you have so much common ground with a difficult colleague. So, say you disagree on medical management or maybe have conflicting ideas on what the patient's home medication should be or even an invasive treatment. By having an open discussion that's patient-centric, you refocus your difficult colleague on what's really important, and that's patient care. So even though it's a high-stakes game, by focusing on the patient, you can make sure that you're able to make the right decisions for the patient, and that's who's most important here. When you feel underestimated as a healthcare provider, you need to be confident in what you know about the patient. Make sure you know everything about the patient, not only from their chart, but also small things like the social history. And you'll be surprised, you oftentimes have a closer relationship with the patient than the physician taking care of the patient too. If you feel underestimated, go armed with information and facts and ask for help. Use the data and interpret it yourself. In order to get what you want, you may phrase your plan in the form of a question, such as, what do you think the best strategy for anticoagulation would be in this patient? That may be a good way to ask, I think we should be anticoagulating this patient. So there are a lot of different ways that you can establish your value and feel worthwhile, but it should never be a contest of who's better trained. We're all on the same team to take care of the patient, and that's what's most important. Sometimes conflict with other healthcare providers is unavoidable, and you have to do a little damage control. Never be afraid to say you're sorry or, I was wrong and I made a big mistake. Can you please help me out? You don't ever want to hit somebody with glasses, so be the first one to confess any mistakes. Additionally, some people will try to drag you into a fist fight or a shouting match, and I want to encourage you to rise above that because you never want to wrestle with a pig because you're both going to get dirty and only one of you is going to like it. So make sure you keep the patient first and be open about mistakes and be willing to discuss anything that's patient-centric. We all went into healthcare to help patients, and that's the most important thing. You've done a lot of training to make sure that you are a qualified healthcare provider. So in the time of conflict or if you don't feel fulfilled, remember that you are doing a great job with your patients, and as long as you're doing your best for every patient, every time, you're doing a good job, even though sometimes we may have disagreements.